One of the greatest advantages of today's IT is the ability to share information on the internet. We have all heard or said at one time or another, Google that. Essentially, there is no greater research vehicle than the internet. Today, I am introducing a video on cardiac stent removal. My name is Patricia Ringel-Rattay, and teaching nursing students through the use of video simulations to enhance clinical education is the topic of my digital story. Most nursing programs use a mixed mode of delivery and include some online delivery components as well. There's a tremendous scope to improve learning and teaching. However, a current rich online environment exists. Clinical experience for students needs to enhance learning and patient safety. One way is through simulations. Schools of nursing are using various technologies to enhance the student learning. For example, learning to pull cardiac sheaths from patients who require intervention. Using a simulation scenario provides the student opportunity to gain confidence in executing the skill without compromising patient care, as well as develop critical thinking skills. Chester just came in with chest pain and received a cardiac catheterization. He required a stent to his LAD, which is his left anterior descending, and he is on your unit. It's time for his sheath to be removed. You are learning this skill to properly take out this interventional device. First of all, you're going to gather all your supplies, like Band-Aid, your blood pressure cuff, your Doppler, cardiac monitor. They're all listed right here. You're going to explain the procedure to Chester and that he's going to experience some mild discomfort when you remove this sheath. You're going to support the site. He's to support the site when he's coughing or sneezing. You're going to instruct him that any wet, warm, or burning feelings or lumps underneath his skin, he needs to let us know right away. You're going to mark the site whether, first of all, you're going to be removing the arterial sheath, and then afterwards the venous sheath, and you'll mark those appropriately so you know which one you pulled. First of all, after you've gathered all of your supplies, you're going to explain the procedure to the patient. You're going to perform a baseline assessment prior to the removal, noting quality of his pulses, what his blood pressure is. You're going to attach a 10 cc syringe to the stopcock. You're going to aspirate 5 cc's of blood from the sheath, leaving the syringe attached and off to the patient. You're going to clean the site with alcohol in a circular motion outwards 3 times to allow that to dry. First of all, you're going to remove the arterial sheath before the venous sheath. You're going to put 2 fingers, 2 to 3 centimeters, right above that insertion site, and you're going to gently pull the sheath out and firmly apply pressure using these 2 fingers for 20 minutes. Stop. Okay. All right. If for some reason that bleeds, you have this femstop that you're going to apply. You already have the belt underneath their hips, and you're firmly going to apply this in place. Usually you have someone else helping you. This is rather tricky to do by yourself. You're going to firmly apply pressure. You're going to know what the patient's, and in this case Chester's, systolic blood pressure is, and you're going to inflate it to 20 millimeters of mercury above that. And that's going to apply occlusive pressure to that femoral artery. Now, you're going to continue to monitor the site to make sure there's no hematoma, there's no bleeding, that you have pulses distal to the insertion site, and you're going to monitor that every 15 minutes for the entire 2 hours. And at that 2-hour mark, you're going to gently lift the femstop, which is the closure device, and gently get it out of the way. Continue to monitor vital signs check for any signs and symptoms of a hematoma. You're going to make sure you still have your pulses distally. That concludes my demonstration on how to remove cardiac sheaths. I hope you find this demonstration informative. In conclusion, the lessons learned through the use of simulation, it enables the student to review and replay scenarios to learn technical skills without compromising patient safety.